Any of y'all ever been to the Outer Banks? I know a lot of y'all have been to Eastern North Carolina. It's a very rural area. These are where farmers are. They're fishermen, they're clergy, people who are the working poor that don't make enough really to be able to afford insurance, especially in today's environment, but also want to work. They're the working people. And so the expansion of Medicaid allowed them to have access to health care, but also continue to work. What the Senate's provision was to take that 90% federal share and drop it down. There is a trigger in North Carolina in the legislature, as well as in, I believe, 13 other states, that said if the federal share dropped below 90%, Medicaid expansion is off the table. It would be catastrophic for North Carolina. Catastrophic for North Carolina. So the things that, guys, I've been practicing in Eastern North Carolina for 35 years, and I continue to do so. Our Medicaid population, for the vast majority, are people who are poor, impoverished, disabled. We have other folks in the expansion population that are working. We need to reform the system. I see patients all the time that, in my opinion, have been put on Medicaid and should be rolled off of Medicaid. But fixing the Medicaid problem is not going to be the way the Senate wants to do it. I won't vote for anything that does that.
Okay.
Period, point blank. And I've told Senator Tillis that in no uncertain terms.
And so you feel like there will be some kind of a fix, something will be changed or tweaked. Is there something you can accept?
Well, I think what the House did was actually thoughtful. I love our senators, but I don't know who wrote that bill. If you look at where trying to get out waste, fraud, and abuse, get the ineligible, get the illegal, and get the folks who are able-bodied back off the system and get them having jobs, good God. If people want jobs in Eastern North Carolina, they have their pick. And those folks pay good wages. They provide good health insurance. That's how you reform a system. Cutting the FMAP is not a tenable way to do it.